ask you something real quick. Have you ever finished a meal and felt completely wiped out? Like you almost needed a nap and all you did was eat? Or maybe you've been feeling thirsty lately, like drinking water all day and still feeling like your throat is dry? Or are you running to the bathroom way more than normal and you can't figure out why? Most people write that stuff off. I'm just tired, I need more water, it's probably stress. But here's the thing, over 537 million people worldwide are living with diabetes right now. That's from the International Diabetes Federation. And nearly half of all these people have no idea until a doctor ran a blood test, a simple one, not a fancy one. So today, I want to talk to you about what diabetes actually is, what's going on inside your body, what to look out for, and what you can do about it, all in plain everyday language. So let's get into it. Hi, I'm Dr. Bernard. I'm a board-certified internal medicine physician. Okay, so first, let me explain what's actually going on inside your body, because once you get this, everything else makes total sense. Every time you eat, anytime you eat anything at all, that is bread, rice, fruits, it doesn't matter. Your body breaks down the food into sugar. We call it glucose. And that glucose is basically your body's fuel. It powers your muscles, your brain, your heart. Everything runs on it. But here's the catch. That sugar cannot just walk from inside your blood to your cells. It needs a key to get in. And that key is a hormone called insulin. Your body makes insulin in a small organ behind your stomach called the pancreas. So normally it works like this. You eat, your sugar level rises, your pancreas releases insulin, the insulin unlocks the door to your cells, and the sugar moves from your blood into your cells where it's used for energy. And what happens to your sugar level in the blood? It comes down. Simple, clean, and automatic. Diabetes is what happens when that system breaks down. Either your body stops making enough insulin that is needed to push the sugar from inside your blood to your cells, or your body is making enough insulin, but your cells stop responding to the insulin. They went either way, the sugar stays in your blood and cannot get into the cells. Because like we said earlier, insulin unlocks the door to your cells for the sugar to move from your blood into the cells. Because your cells need it for energy. Your body runs on that. So when this sugar cannot get into the cells, what happens? They build up in your blood instead. Sugar is meant to move from your blood into your cells for energy. Sugar is not meant to just sit in your bloodstream. So having too much sugar sitting in your bloodstream for too long, over months and over years, it starts to damage things. Your blood vessels, your nerves, your kidneys, your eyes, that's where serious problem comes from. And that's exactly why catching diabetes early matters so much. Now, I need to stop here because I know this trips a lot of people. When people say diabetes, they are not all talking about the same thing. There are 3 types of diabetes and they work differently. Type 1, this is an autoimmune condition. What that means is your own immune system, the one that is supposed to protect you, gets confused and attacks your cells in your pancreas that makes the insulin. It destroys them, and so your pancreas just stops making insulin completely. People with type 1 diabetes have to take insulin every day to stay alive. And I want to be really clear. Type 1 diabetes is not caused by eating badly. It has nothing to do with someone's diet or lifestyle. Like I said, it's an immune system problem. And it can happen at any age and is nobody's fault. About 5 to 10% of all diabetes cases are type 1. Type 2 diabetes. This is what most people mean when they say diabetes. Here, your pancreas is still making insulin, but your body cells have started to ignore the insulin. So think of it like this. Imagine knocking on a door every single day for years. Eventually, whoever is inside just stop answering. That's what happens with your cells and insulin. They tune out. This is called insulin resistance, and it builds up slowly, often over years before a person even knows anything is wrong. Type 2 diabetes makes up about 90 to 95% of all diabetes cases. The other type of diabetes is gestational diabetes. This is diabetes that happens during pregnancy. Pregnancy hormones can interfere with how insulin works, so blood sugar goes up. It usually resolves after birth, but it does raise the mother's risk of type 2 diabetes later on. So doctors watch it closely. So what does diabetes actually feel like? Because this is the sneaky part, especially with type 2 diabetes. You can have it for years and feel mostly fine, maybe just a little off. that you brush it off as other things. But here's what to pay attention to. Going to the bathroom way more than usual, being really thirsty all the time, even when you've been drinking plenty of water, feeling exhausted in a way that sleep doesn't fix because your cells can't get enough energy they need, blurry vision, cuts or wounds that takes weeks to heal when before they only heal in days, or tingling and numbness in your hands and feet, which is usually a sign that things have been off for a while. If you have 2 or more of these things I just said, or someone close to you, please go get a blood test. Not to scare anyone, but because the earlier you know, the better your options. So now you know what diabetes is and what the warning signs look like. But I want to take a couple of minutes here to talk about why any of this actually matters. Because I think when people really understand what uncontrolled diabetes can do to the body, not in a scary way, just in a honest way, that's when it clicks. That's when people stop putting off the doctor's appointment. So here's the thing. Your blood vessels run everywhere from your heart down to your toes. And when your blood sugar stays high for a long time, for like months to years, it slowly damages these vessels from the inside. Think of it like rust building up inside a pipe. On the outside, everything looks fine. But inside, things are quietly getting worse. So let me walk you through what that actually means for your body. Let's start with your heart. This is the big one. High blood sugar damages the walls of your blood vessels, and it causes a buildup of fatty deposits, which can eventually block your blood flow. That leads to heart attack and stroke. And I don't just say this lightly. Cardiovascular disease is actually the #1 cause of death for people with unmanaged diabetes. The data on this one is undeniable. Look at the UK prospective diabetes study that was published in The Lancet. It's one of the longest running comprehensive diabetes studies ever conducted. Researchers showed a direct link that poor blood sugar control dramatically drives up your risk of heart attacks, strokes, and severe vascular complications. This isn't just a minor side effect or a small risk to look out for. When you have diabetes, protecting your heart is the single most important objective on the board. Now to your kidneys. Your kidneys are basically your body's filter system, and they're extremely sensitive to changes in blood sugar. Over years, high glucose level damages the tiny blood vessels inside the kidneys until they stop filtering properly. This is called diabetic nephropathy, which just means kidney damage caused by diabetes. And here's the sobering statistics. Diabetes is the leading cause of kidney failure in many countries. The reason it's so dangerous is that it happens silently. No pain, no obvious symptoms until it's advanced, which is exactly why people with diabetes get their kidneys checked regularly. Not because something is already wrong, but to catch it before it gets there. Now to your eyes. There's a condition called diabetic retinopathy. The back of your eye, called the retina, is lined with tiny blood vessels. High blood sugar damages those vessels over time. They can leak, swell, or grow in ways they shouldn't. And if this goes unchecked, it can lead to serious vision loss. According to WHO, diabetic retinopathy is one of the leading causes of blindness in working age adults globally. And here's the part that really gets me though in most of these cases. If diabetes is caught early, it's very treatable. The damage isn't inevitable, but you have to catch it. And you catch it by doing a blood test. Let's talk about what diabetes does to your nerves. This usually shows up in the feet and leg first as tingling, numbing, burning, or sometimes a complete loss of feeling. It's called diabetic neuropathy. And the loss of sensation in your feet is actually more dangerous than it sounds. Because if you can't feel a cut, a blister, or a small injury, then you might not notice it. And in someone with diabetes where circulation is already affected, small wounds can become serious infection and can lead you to lose your foot or your legs. So yes, you can lose your foot or your legs from uncontrolled diabetes. This is why foot care is such a big deal in diabetes management. Not because it sounds dramatic, but because small things can become big problems when you can't feel them happening. Now I want to be really clear about something. I'm not telling you all of this to make you panic, because here's what that same research shows. Every single one of these complications is significantly less likely when blood sugar is well managed. The UK prospective diabetes study I mentioned earlier found that people who kept their blood sugar under tighter control had dramatically lower rates of all these complications. So that's the flip side of everything I just told you. Managing this condition, managing diabetes, whether through lifestyle, through medication, or both, genuinely helps protect your body. The danger is not inevitable, it's not a done deal, it's what happens when diabetes is left unmanaged. And that's exactly why knowing matters. I want to end on something that I think is genuinely one of the most important things I can tell you about diabetes. Before most people develop full type 2 diabetes, they go through a stage called the prediabetes. Your blood sugar is higher than normal, but not quite high at that level that it's going to be called diabetes yet. It's your body's early warning system, like a yellow light, not a red one. The CDC says that more than 96 million American adults have prediabetes right now. That's 1 in 3 adults, and over 80% of them don't know it. They are walking around with the warning light on and no one's told them. But here's the powerful part. This is the stage where you can actually change the outcome, the prediabetes stage. There's a well-known clinical study called the Diabetes Prevention Program. It was funded by the National Institute of Health. And they found out that people with prediabetes who made modest changes like losing a little weight, adding regular walking, they reduced the risk of developing full diabetes by 58%. For people over 60, that number was 71%. So that's diabetes. That's what it actually is, how it works, what to watch for, and why catching diabetes early is such a big deal. Now you know about diabetes. I've got a whole separate video where I explain how to manage your diabetes and control your blood sugar. And I also go through the biggest myths about diabetes that people believe and they get it completely wrong. Things like you got diabetes from eating too much sugar and you can never eat fruit again. There's a lot of bad information floating out there and I want to clear all of it up. So make sure you're subscribed so you don't miss them. If this video helped you, share with someone, a parent, a friend, someone who has been brushing off these symptoms. You never know who in your life needs to hear this. Drop a comment below. Did anything here surprise you? I would love to know. And I'll see you in the next video. Thanks for watching.